Hey y'all, this is J Marie of J Marie Booklets. I hope you can hear me over this waterfall. I got the ducks around me. They looking for some bread. I ain't got nothing for them. But I want to make a video and about companies and the computers going down and being hacked. So one of the things that I always talk about is to always be prepared. Like I'm very proactive, and they just had an incident where a hospital is, let's see, what is the name of it? Let me see. Universal Health Services. It's a chain of hospitals in America, and they had all of their hospitals hit. They were with malware, so they had a malware attack. And the in the article it described how the staff was scrambling. It was chaos. It was the doctors had to go back to manual, putting in orders manually. The nurses had to put in vitals manually. Oh, and if y'all ever seen the manual, like when the computers go down, the sheet for like each patient. So when the nurses do the vitals and the history and physical and all that, that's a lot of okay. I'm like, I don't know how y'all nurses even look at this sheet of paper. It'd be like just 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 all this information, and that's just before they start filling in stuff. It's just the questions, and it's just too much. I don't know, I just never liked the downtime forms because it was just too much. I don't know how the nurses did it. And then they talked about how the lab, and you got to scan your orders down to the lab, and then you got to wait for the results, and it was just a mess. Now luckily they were able to, like, none of the patients' medical records were affected, so all that was intact. Once they got the results back, they can upload it to the system. But still, okay, and this is every hospital that they had in their system, and it was hospitals and clinics, and then it was more, I think they said it was like behavioral and mental health type of facilities. And then you see the duck behind me. It was some bread. And it was in California, Texas, Florida, and let's see where else. It was one more place: California, Texas, Nevada, and Florida. So across the country they had this issue with malware. And one of the things I always say is always be prepared in case the computers go down, or in case a terrorist attack. I know a lot of people are getting this work with the pandemic, because it's just like a whole nother beast. And then of course with the computers going down, and we in the middle of a pandemic, you got the ER. You don't know who has what when they come to the ER. I mean, you don't know anyway. But still, now you got a pandemic. These people could have cooties, and they're in your ER sitting next to that person, and it's a long wait. So one of the things is to always be prepared in case the computers go down. I got a video in the system. I'll put a link to it, where I talk about what to do when the computers go down, how I prepare my day, because I always prepare in case something happens, because you never know. And so I feel sorry for them. Ooh, because like I don't think I've ever been in a long with the computers down. I think the most I ever was like 2 hours. Hold on, that was me. Was 2 hours, and like they announced it. The operator announced it over the intercom that I forgot what the code is, but it's like something level 2. That means 2 hours. I do remember one time the phones went down, but I think I want to say it was just the desk phones, because they were trying to upgrade the system, or I think maybe they were changing. I think they were changing the provider for like the TVs. You know how the patients have TVs in a room, and the cable and the satellite. I think they were changing it, like changing the company, and they hit a fiber and it knocked the phones out. It was something weird like that. I want to say it was. But I think the portable phones, like that the nurses carry, I think they were still able to function. So we were down, but it wasn't that bad. And I think that might have been like a day or two. I think they might have been on the weekend, so it wasn't really that bad. Now I do remember that I heard, because I wasn't there, I was at the house, but the computers had went down for 8 hours. And I want to say I was still on the med surge floor, And then it might have happened again when I was in the ICU. So yeah, you know, 8 hours. Ooh. I was like, I'm glad I was at the house. I'm glad y'all didn't call me because you know I come in and get some money. No, I was so glad I was at the house. 8 hours. Ooh, yeah. And now these people at this hospital, it's every facility across the country. Every facility you have in the middle of a pandemic, you have malware attack. And of course, you know, we're hearing about it at hospitals because you know, people, you know, not good people are trying to, you know, get ransom. So, you know, so this might happen again. I know it's happened in the past. It'll probably happen in the future. People try and get some money, hacking into people's stuff, and so just always be prepared. Just always be prepared for that computer to go down, be down for a while. Okay, especially you know during this time. Just know the steps to do if the computers go down to make your life a little bit easier because it's gonna be hell. I tell you that right now. All right, y'all. Don't forget to subscribe to the channel if you haven't. You can follow me on my blog. It's J. Marie Booklist. That's where I talk about being a health unit coordinator. And I'll talk to you later. Bye.